Understanding Autism in the Classroom. This video is brought to you by Connecting Stars, Counseling and Behavior Therapy. Connecting Stars is a private home-based company that offers ABA, VB, and IBI services for children with autism. We offer success in social, play, communication, and independent living skills for children of all ages. The contents of today's video will discuss what is autism, we'll discuss genetic and environmental factors, we'll briefly touch on genes responsible for autism, environmental causes for autism, statistics, communication methods, and basic teaching strategies. What is autism? The characteristics of autism include social and relationship skills, communication skill deficits, play and leisure skill deficits, as well as some behaviors that may or may not be present. Individuals with autism may have difficulty with eye contact, initiating, responding to peers, turn-taking, requesting items desired, commenting, protesting and/or advocating for self-needs, social communication, and conversation skills. There are several barriers to communication for children with autism. This may include limited receptive and expressive skills, cognitive impairment, social understanding, and challenging behavior. You may see anxiety, sensory processing challenges, attending skills, and oral motor planning that may affect speech production. In understanding autism, saying hello in topical conversations may be quite challenging. Reciprocity may be missed, sarcasm, figurative language, and idioms, such as, "I think I have butterflies in my stomach for this performance." A child may actually presume there's butterflies in your stomach. If daycare has only open-themed toys, this may be quite challenging. What I like to do is set a thermometer and have the child build their emotional regulation skills from 1 to 10. 1 would be, I'm happy. 2 can be, if I don't get my way, I may start to whine, up to 10 where I'm screaming and crying. We want to teach skills on the other side from 1 to 10 that may help reduce these behaviors. Number 2 may be, I'll use my words. And number 7 can be, I'll go to my room, listen to my favorite song, and take 10 deep breaths. The next portion of this video will discuss the genetic or potentially environmental factors that affect autism, or perhaps it's both. There are many studies in regards to autism prevalence. However, from my research, I've noticed that the co-occurrences of identical twins revealing autism is 40 to 80%. Thus, we can conclude if it were 100%, then it would be only due to genetics. So from this, we can postulate that genes are important, but there are also other known environmental factors involved, which we do not know of yet. There's a 5 to 10% chance of siblings developing autism, and there's a 25% chance of a major speech delay. I highly recommend a David Suzuki video that noted that autism has increased 600% over the last 20 years. Autism was projected to affect 1 in 4 families. It's important to understand that genetic vulnerability plus environmental exposure, and keep in mind that genes alone produce proteins, not behaviors, and we can understand there's no linear line from genes to behavior. There are various environmental causes that have been discussed in relation to autism. We can look at our food, transportation, preservatives, our industry in general. There's no general agreement. However, possible causes may include high levels of heavy metals, excessive oral antibiotic usage, which may have damaged the gut. There's a lot of discussion over vaccine damage, exposure to pesticides, lack of essential minerals, and other unknown factors. I recently attended an Autism 1 conference, and a wonderful speech was discussing population. And when population is accounted for in rural and urban areas, the autism prevalence is higher in urban areas. The next section of this video will concentrate on communication methods that you may use in the classroom when integrating and facilitating social skills. I like to break down our communication methods into 5 different groups. One is requesting, which is asking for something, which is also demanding. Number 2, labeling, which is often labeling an object. So if a little guy sees an airplane, he'll say, "Mom, look, an airplane." Number 3 is receptive identification, which is following instructions given by others. So if you tell your class, "Okay, everyone sit down," the little guy with autism will follow the instruction. Number 4 is intraverbals, which you may think of as conversation, can involve answering WH questions or having a conversation. And the last one, number 5, is repeating exactly what was heard, which is called echoics. So knowing this, what we want to do is have the child use these functional skills to express their needs and desires, rather than having a requesting failure, as I like to call it, when a child screams or pushes in order to gain access to a desired item. What I normally see is as we teach the child appropriate means of communicating, the behaviors will decrease as it's easier to use their language, or perhaps it's a sign or a peck or a visual picture. So some basic teaching skills and methods that I like to talk about are beginning with step 1, where you identify strong motivators and reinforcers for the child. So this can be a game, it could be tickles, perhaps it's a sticker. You want to pair yourself with these reinforcers, and therefore the child will approach you to receive these reinforcers. Start with easy and infrequent demands and slowly increase and reinforce the child for following your demands. What this would look like is you're going to prompt the child to say the word or point to the picture that you would like. So for example, if it's a ball the child wants, you're going to tell him, "Say ball." The child echoes, "Ball." And research shows that in order for learning to occur, there must be a transfer trial. What this will mean is you're going to say, "Huh?" And the child will have to independently request ball. You're going to immediately reinforce with the ball. Now, if the child fails to request on the independent trial, just start over again and repeat until you have that independent trial. You can use gestural, physical, verbal prompts to help the child, and ensure that you fade them quickly, as children may become prompt dependent if you don't fade. Statistics. When I initially made this video, the statistics from the CDC were that autism was 1 in 150. Now, today, this is much different, and I'll leave it to you to check up on the current statistics. When teaching requesting, what you would like to do is gain the attention of the child and ensure that you're using the reinforcers that they are motivated by. You want to have these toys and objects visible and ensure that the child understands the task. You want to use first then language, so first come sit down and then you can have the ball. You may use a token board, and this would look like in a daily week, we go to work every day and receive our paycheck at the end of the week. On a smaller scale, children will do 5 tasks prior to getting the ball. So when they get all 5 tokens, then the child gets a reward. As you give each token, you're telling the child, "That's great, you're sitting down, I love your listening." Very specific praise so the child understands what you're looking for. Communication and behavior. You may see anxiety due to communication deficits, difficulty with judgments, restricted range of interests, and sensory differences. And challenging behavior may be a way of reducing anxiety for the child. So use the visual aids to enhance communication, as visuals can improve comprehension and organization, decrease anxiety, promote independence, and help with transitions or shifting of attention. So for example, this can be a schedule which lists what the child is doing in the day. First then token boards, calendars, choice boards, and a menu of options available. Thanks for listening.